Good afternoon. A special welcome to the ladies and happy Women's Health Month. Thank you for taking the time out of your day to join us for this special webinar on women's health. My name is Miranda Morales, and I'm a benefits specialist on the BEWell team here in Virginia Beach. I hope you're ready to take a deep dive and go beneath the surface to explore how BEWell programs and resources can support healthy women through every season of life. As a reminder, we have a lot of great programs and resources to support you here at Virginia Beach City and schools. Joining me today are representatives from each of these programs you see listed on the screen. In a moment, I'll pass the mic and we will take a few minutes to hear from each of them so you can become familiar with the resources and helpful information surrounding women's health, including preventive care, mental and emotional well-being, reproductive and maternal health, menopause support, and other women-focused programs, along with instructions on how you can access their services through BeWell. If you want to go ahead and let me know in the chat, which of those are you most looking forward to hearing about? We'd love to see what drew you into the webinar today. We have a lot of great information to share with you, and we would like to ask you to please hold your questions until the end so that we can ensure that all our speakers will have the time they need to present. This session will be recorded in case you would like to rewatch it later and for those who are unable to attend. For attending today's live session, you will be rewarded with 300 points. We will send an email within about a week with an electronic voucher code. And while those points and cash rewards are great, we truly feel that the benefits of our programs vastly exceed any money earning opportunity. It's all about providing you with the tools to help you develop healthier habits and live happier lives. And so without further ado, let's get started.
Great. Well, hello, everyone. My name is Kira McInerney, and I am an account manager with the Guidance Resources Program. We are the provider of your employee assistance program. So thank you so much for having me today. With today's focus being on women's health and wellness, we really want to highlight the resources available through the Guidance Resources Program. You can think of the Guidance Resources Program as a trusted support system you can turn to whenever life feels complicated. Support is available 24/7 through your program's toll-free number or online at guidanceresources.com. The program is fully integrated, which means you don't have to search in multiple places. Counseling, work-life support, legal, financial, and well-being are all part of the same program. All services are provided by licensed professionals, and everything you share with us is completely confidential. Your participation in the program is always optional as well. It's there when you need it on your terms. Next slide, please. So while we understand that women's health needs change across different stages of life, physical and mental health are closely linked and affect our overall well-being. So access to reliable information will really help you make informed decisions. So with that, we wanted to spend some time reviewing some of the resources that are available through the Guidance Resources Program. And I'm going to turn it over to my colleague Furwa to review some of those resources.
Good afternoon, everyone. My name is Farwa, and I work alongside Kira as an account manager supporting on the Guidance Resources Program. So again, I'm just going to discuss a little bit more about the different tools and resources that we offer in all sorts of matters of life. So ComSci Guidance Resources recognizes that women often experience unique stressors between balancing careers, caregiving, family roles, and hormonal changes. These are all factors which can influence mental health, and the symptoms can also present differently in women in the form of fatigue, irritability, emotional overwhelm, and even physical symptoms. Women are also likely to face unique challenges in the workplace. We may face overload, inequities, or burnout at higher rates. These are all just a few reasons why Guidance Resources provides mental and emotional health resources specifically to support women across all the different stages of life. We offer completely confidential counseling delivered by licensed professionals. But in addition to the counseling, we offer a variety of resources and interactive tools to help individuals recognize symptoms of depression, understand when to seek support and what to expect when starting out, and learn tips on how to manage symptoms and practice self-care. These resources aim to reduce uncertainty and encourage people to take the first step towards strengthening emotional well-being. So throughout our lives, women experience a plethora of physical and reproductive health matters, which can often be challenging to navigate and can in turn have a strong impact on our mental wellness. We offer resources that cover physical health across the lifespan, including pregnancy, postpartum recovery, hormonal changes, and chronic conditions that disproportionately affect women. These resources include cesarean section preparation and recovery guidance to help women understand what to expect before and after surgery, postpartum support resources for both physical recovery and emotional well-being, vastly important during a period of time when many women may feel isolated, and endometriosis and PMS resources that help women identify symptoms, understand treatment options, and manage daily impact. Along with the educational materials, Guidance Resources offers self-help tools through interactive digital content with Care 360, where you'll find engaging activities built to address the most common behavioral and physical health factors. These tools empower women with reliable, accessible information rather than relying on advice across internet searches, which may be misleading or inconsistent. Menopause is a major life transition that affects physical, emotional, and cognitive well-being. Many women feel unprepared or unsupported during this stage. Guidance Resources aims to change that. Menopause is not just a medical event, it's a holistic transition that can impact work, relationships, or even self-identity. Our program offers tools to maintain long-term health, including bone health, heart health, and emotional resilience. Many of the Care 360 activities allow women to recognize and address common symptoms such as hot flashes, sleep changes, mood shifts, and cognitive fog. And these resources will help to normalize the conversation around menopause, reducing stigma and encouraging support. Prevention is a cornerstone of women's health, and we want to highlight a number of our resources that promote long-term well-being. With heart disease being the leading cause of death for women, the Healthy Heart Handbook for Women provides practical guidance on risk factors and lifestyle habits. Resources and articles on nutrition help pregnant women make safe choices and avoid foods that may pose risks. And we offer guidance on fitness after childbirth to support a safe return to movement and also helping women rebuild strength and confidence. Preventive care empowers women to take control of their health before issues arise, and Guidance Resources provides essential educational tools to support that. We'd also like to highlight ComPsych huddles, which are virtual expert-led group discussions designed to make support more accessible and community-based. They allow individuals to connect with others who share similar experiences or challenges and can be easily accessed through guidanceresources.com. Just go to Browse All Services and navigate to the Huddles tile. Huddles are self-scheduled, making them easy to fit into busy lives. They cover a wide range of topics from mental health to work-life balance, parenting, and much more. And soon we will be launching the Women's Alliance, which will focus on topics like menopause, working women's mental health, and peer support. These sessions create a sense of community and reduce the feeling of going through it alone. You can call us at any time at your dedicated toll-free number. Our guidance consultants are available 24/7 to provide you with support. And you can also utilize our services by visiting guidanceresources.com. First-time users will need to register through the register option on the login page and enter your dedicated web ID, Virginia Beach. And you can access the Care 360 portal through guidanceresources.com using the Connect Me feature to navigate to self-guided resources and digital self-care tools.
Good afternoon, everyone. My name is Georgianne Dutton. I am your account manager for Personify Health. And today I just want to walk through some of the women's health resources available to you through your Personify Health Wellbeing program. So whether you're navigating menstrual health, perimenopause, preventative screenings, or just looking at reliable health information, There are tools designed to support you at every stage of life. So first we have 13 journeys specifically designed for women's health. One I want to highlight is the menstrual health, confidence through every phase of the journey, which provides guidance and support throughout your cycle. These journeys are self-paced and give you actionable steps you can take on your own time. The media library has video content on topics that matter to you. So for example, there's a great video called Conversations, Putting the Pause in Perimenopause that covers what to expect and how to manage your symptoms. New content is added regularly, so it's worth checking back in. My Care Checklist is a tool that helps you stay on top of your preventative care. You can track your mammograms, your PAPs, colonoscopies, and other important screenings all in one place. It's a simple way to make sure nothing falls through the cracks. If you search for the Women's Health in catalog under Discover, you'll find healthy habits, benefit information, and more, all curated in one convenient location. To access all of these resources, you'll sign in personifyhealth.com and head to the health section. I encourage you to sign in regularly because the content refreshes and is personalized just for you. You can also scan the QR code on this slide to get started right away. Please note that My Care Checklist is only visible to members on the Virginia Beach City or Schools health plans. Pelvic floor issues are incredibly common. They affect millions of women, but they're often something people don't talk about or seek help for. The good news is that we've partnered with Kaya Health to provide personalized at-home therapy at no cost to you. This means you can get the support you need from the comfort and privacy of your own home. Kaya Health covers a range of conditions, so let me walk through what's included. Pelvic pain. If you experience chronic or recurring pelvic pain, Kaya offers guided therapy sessions designed to help manage and reduce discomfort over time. For new moms, recovery after childbirth can be challenging. Kaya provides postpartum specific exercises and support to help you rebuild strength and feel like yourself again. Bladder and bowel issues. These are more common than people realize, and it can be significantly impact your quality of life. Kaya addresses these concerns through targeted pelvic floor exercises. And then as we age, pelvic health can change. So whether you're going through perimenopause or menopause, Kaya has programs tailored to help manage symptoms and maintain your well-being. And beyond pelvic health, Kaya supports general musculoskeletal issues like joint and muscle pain. So it's a versatile resource for your overall physical well-being. And here's what makes Kaya really accessible. Each therapy session is personalized to you and only takes about 15 minutes to complete. Easy to fit into a busy schedule. You get unlimited access at no cost to you. This is fully covered as a part of your benefits. And because it's app-based, you can use it anytime, anywhere, at home, traveling, and whenever it works best for you. On the next slide, I'll walk you through exactly how to get started with Kaya Health. The enrollment process is simple and only takes a few minutes. So now you know what Kaya Health offers. Let's walk through exactly how to get started and what the full member journey looks like, from enrollment all the way through to outcomes. So getting started is simple. Sign into Personify Health on the desktop, laptop, phone, or tablet. Go to the Benefits tab, find Kaya Health, and click Start Now. That's your entry point. After you're enrolled, you can download the Kaya Health app and access your account directly from that going forward. So you don't need to go through Personify Health each time. Once you click Start Now, you'll complete a few fields to create your own Kaya Health account. You'll download the app to your phone and log in using the same credentials. You'll then authenticate with Personify Health to link everything together. This whole process only takes a few minutes. Next, you'll complete the Kaya Health Intake Assessment. This is how the program personalizes your experience based on your responses. You'll either be directed into the digital pelvic health pathway, or if your needs are more complex, connected with a pelvic floor physical therapist for more comprehensive evaluation. Either way, you're going to get the right level of care. And then once you're in, here's what you can expect. The core musculoskeletal program gives you exercises, mindfulness and relaxation techniques, educational content, and ongoing digital access. If you're on the pelvic health pathway, you'll also get condition-specific intake, pelvic floor education, and targeted pelvic floor exercises on top of everything in the core program. The goal of this entire journey is improved pelvic health and overall well-being. Whether you follow the digital pathway or you work with a physical therapist, Kaya is designed to meet you where you are and help you make meaningful progress over time. So now that you know how Kaya Health works from start to finish, let's shift to another partner resource, the X program. So now that we've covered Kaya Health Partnership for Pelvic Health and the member journey to get started, I want to shift to another important resource, the X program. This is your tobacco cessation program, and it includes resources specifically designed for women's health, with a strong focus on fertility, pregnancy, and quitting. The X program offers a web article focused on smoking and pregnancy. It's a great starting point for members who are expecting or planning to become pregnant, covering the risk and practical steps for quitting. There's also a text message library tailored to a member's delivery date. It sends weekly messages for 9 months prenatally and 1 year postpartum, supplementing the standard X text experience with pregnancy-specific encouragement throughout the quit journey. The Exit community includes a dedicated group for pregnant quitters, a peer support space where members can connect and others going through the same experience. It's a safe, judgment-free environment that can make a real difference. And for broader reading, there are Mayo Clinic blog posts covering both pregnancy and women's health topics. These are expert reviewed and available anytime. You'll notice the step-by-step instructions on the right side of this slide. Just like with Kaya Health, you access the X program through Personify Health, sign in, go to the Benefits tab, find Tobacco Cessation, the X program, and click Start Now. It's a simple process. So to recap what we've covered today, your Personify Health Wellbeing program offers a wide range of women's health resources, from journeys and preventative care tools to personalized pelvic health therapy through Kaya Health to the X program's pregnancy and tobacco cessation support. All of these are available to you at no cost through Personify Health. So I really encourage you to sign in and explore. Thank you.
Hi, everyone. Thank you for having me today. My name is Kelly, and I am a Partner Success Manager here at Wellbeats. Today, I will highlight how Wellbeats supports women's health across different stages of life. Our content is designed to meet women where they are, whether they're focused on nutrition, fitness, hormonal health, pregnancy, postpartum, recovery, or overall well-being. The goal is to provide approachable, expert-led resources that help women feel supported, strong, and confident in their health journey. To start, I want to quickly walk through the member login experience for Wellbeats through the Personify Health platform. First, we recommend members start on a desktop. From there, it's very simple. You will click on Benefits, find the Wellbeats tile, and select Start Now, which will then take you directly into your Wellbeats homepage. After that initial login, you can access Wellbeats on a computer or take Wellbeats with you via our mobile app. We offer a variety of women's health content across 3 key areas. First, nutrition, where members can access classes focused on pregnancy nutrition, postpartum recovery, and practical everyday nutrition guidance. Second, workouts, which include safe and effective pre- and postnatal fitness classes designed to help women maintain strength, mobility, and overall fitness during and after pregnancy. And finally, PCOS education, where members can learn more about symptoms, hormonal health, and strategies to support overall well-being. Wellbeats offers a variety of individual classes designed to support women across different stages of life. This includes prenatal and postpartum fitness and nutrition classes, PCOS education, and women's nutrition content focused on practical, everyday healthy habits. We also provide perimenopause-friendly workouts that will focus on strength, mobility, and endurance to help women stay active and feel their best during those hormonal transitions. In addition to individual classes, we also offer structured programs designed specifically for women navigating hormonal changes later in life. Our Peri-Power program supports women in perimenopause with workouts that focus on strength, flexibility, and energy while working with hormonal changes. And Prime Power is designed for postmenopausal women with workouts that help improve strength, mobility, endurance, and overall well-being. And what we consistently hear from members is that these classes are not only helpful, but also easy to integrate into their daily lives. Members appreciate the quick, practical nutrition content and the targeted workout programs that help them feel stronger and more energized. These are specifically from some of you, so you might see some of your own testimonials here on the screen. And overall, the feedback shows that these programs provide meaningful support for women at different stages of their health journey. Thank you again, and I am excited for everyone to start exploring your Wellbeats benefit.
Good afternoon, everyone. My name is Meredith Stringer, and I am the account manager here at Wonder Health. Excited to share a little bit about the Wonder Health journey and how we support women's health when it comes to menopause. So what Wonder does for you? Wonder gives individuals a better way to better health by teaching practical skills to creating a healthy relationship with food, shedding excess weight, both physically and mentally, building a robust immune system, strengthening that quality of sleep, enhance your overall quality of life, relieving stress and anxiety, and creating an enjoyable, active life. We also discuss weight-related condition support, so delivering more personalized support strategies for conditions related to your metabolic health. So we discuss root causes of weight and weight as a root cause. So we'll look at emotional health, sleep, weight management, gut health, and we'll also provide additional content that supports diabetes, brain health, cardiovascular disease, and preventative MSK. Now we dive into a little bit how Wonder supports menopause here within our program. So menopause is not a single moment, it's a journey, and every woman experiences it differently. As hormones shift, many women notice changes in their weight, body composition, sleep, mood, energy, long-term heart, bone, and breast health. These changes are real and they're deeply personal. The good news is, at Wonder, women don't have to navigate menopause alone or push through the symptoms. We have holistic, personalized approaches, one that brings together nutrition, movement, stress management, and overall healthy self-care, which can help women feel stronger, more balanced, and more in control at every stage. One of the most impactful ways Wonder supports women through menopause is by simplifying nutrition. So rather focusing on dieting, the program emphasizes fueling the body in ways that align with hormonal changes. So women are guided towards meals rich in protein, fiber, healthy fats, and key nutrients. At Wonder, we want to make menopause supportive nutrition practical and approachable so women are better equipped to feel well and confident in their daily lives. But outside of nutrition, we also like to discuss movement. Movement during menopause isn't about intensity or burning calories. It's about function, strength, and sustainability. Our program encourages regular physical activity that helps women maintain muscle and bone health, support metabolism, and improve overall sleep and reduce stress. Women are guided towards a balanced approach, so combining simple walking, strength training, stretching, and balance work, these kind of movements support energy, confidence, and resilience at every stage of menopause. But we even take it a step further. So we'll discuss your emotional health, sleep, and your stress support. So menopause often overlaps with demanding life stages, which can affect mood, focus, and of course, sleep. And Wonder recognizes that emotional well-being is a core part of menopause care. When emotional health is supported alongside your physical health, women often experience greater clarity, again, resilience, and overall better quality of life. So as you can see on this slide, we have many tools you can utilize. This is just a handful of them, but we'll discuss the power of your sleep skills. We do have a menopause-specific meal plan, and we also have 10-minute mini workout videos that you can use throughout your day. And all of these resources can be found within our program, which is available on demand digitally on your computer or on your Wonder app. And our health coaches are there to support you as well. So if any of this speaks to you, no matter if you're in your menopause journey or looking for some more education about it, we'd love for you to check out our program. Please visit the wonderhealth.com/BEWell to learn more. You can also email into our support team if you have questions, or health coaches would be happy to answer. You also can join the wait list. We will have a class, I think an application opening up in August, so we would love to have you. Thank you guys so much.
Good afternoon, everyone. My name is Shelby Pop, and I'm the supervisor for Partners in Pregnancy with the Commercial Case Management Team. And today I'll be walking you through the women's health resources available through Sentara Health Plans. Sentara Health Plan supports women through every stage. My goal is to help you understand what's available, how these programs can benefit women, and how to easily connect with these resources. We will be covering preventative health and wellness tools, telephonic case management programs, Ovia Health, and well-being resources. Preventative screenings are essential for women's health, helping detect common conditions early, often before symptoms appear. Early detection saves lives. Screenings such as breast cancer, cervical cancer, osteoporosis, and cardiovascular risk assessments play a key role in identifying issues early and often improving long-term health outcomes. Members can learn more about reducing their risk by visiting the Sentara Health Plan's website or app under Prevention and Wellbeing, Reduce Your Risk. This section provides education on various health conditions, helps members understand personal risk factors, emphasizes the importance of routine checkups, and offers recommendations and interactive well-being tools to support healthier living. Sentara Health Plans also offers resources and webinars focused on total well-being, including nutrition, tobacco cessation, movement, sleep, and stress management. These topics directly support women's health across the lifespan by promoting lifestyle habits that reduce risk, improve energy and mood, and support hormonal and reproductive health. These resources can be accessed via the SHP website. Go to members and then health and wellness. I apologize. Are you able to hear me still? I'm so sorry.
Yes, I can hear you.
Sorry about that. Okay. And Sentara Health Plans offers case management support for women who are managing ongoing or complex health conditions, need help navigating the healthcare system, or want support reaching their health goals. Our Virginia Beach advocacy team includes clinicians who work one-on-one with members to provide personalized support and help women understand and make the most of their health plan benefits so they can reach their health goals. Case management is especially valuable for women because health risks do often change across the lifespan, particularly with hormonal shifts such as pregnancy and menopause. For example, many women don't realize that heart disease is actually the #1 cause of death in women, responsible for about 1 in 3 female deaths. Cardiovascular disease kills more women than all forms of cancer combined. Nearly 45% of women over the age of 20 are living with some form of cardiovascular disease. Our team focuses on key areas where women experience unique risks, including cardiovascular health, chronic conditions, autoimmune disorders, pelvic floor health, bone health like osteoporosis, and the perimenopause and menopause transition. We support women by helping them understand their diagnoses and provider recommendations, coordinating care across multiple providers, promoting lifestyle changes that reduce long-term risk, and connecting them to condition-specific and community resources. For women with qualifying chronic conditions, incentive programs may also be available to help support engagement in healthier behaviors and ongoing care. Next slide, please. Thank you. Our Partners in Pregnancy, or PIP, case management program is available to all Sentara Health Plans members at no cost. This telephonic program supports individuals experiencing infertility, miscarriage, pregnancy, and the postpartum period up to 1 year, as well as infants through their first year of life. Our nurses provide coaching, advocacy, education, and connections to community resources to ensure that members have the support through their journey. We can help members access parenting and birthing classes, breastfeeding support, and other educational services. We also complete screenings and assessments to identify risk factors and work with members to create individualized care plans that support healthier outcomes. When needed, we can help connect members to mental health resources and network providers and local or virtual support groups. For the City of Virginia Beach and schools, there's an incentive program for eligible pregnant members who meet specific criteria. To meet eligibility, you must be a full-time employee or a retiree enrolled on a City of Virginia Beach or school Sentara health plan. Criteria includes enrolling in the first trimester, completing an OB visit in the first trimester, talking with the case manager monthly, and developing a nutrition and activity plan, and also completing a postpartum visit within the first 6 weeks after delivery. The Partners in Pregnancy case management team is available Monday through Friday from 8 a.m. to 5 p.m. BEWell is an interactive digital tool available to all women ages 18 to 50. It supports every stage of the journey from cycle tracking and fertility to pregnancy, postpartum, lactation, and even perimenopause and menopause. The app provides personalized insights, daily guidance, and education tailored to your stage of life. Members also have unlimited in-app support with access to a dedicated care team available by phone, video, or in-app messaging 365 days a year. Ovia is included at no cost for eligible Sentara Health Plans members, and it's designed to give women continuous on-demand support whenever it's needed. You can download Ovia from the App Store or Google Play. The app personalizes your experience based on your goal. So whether that's cycle tracking, trying to conceive, pregnancy, postpartum, or navigating perimenopause and menopause. There is also an Ovia parenting app that helps you track feedings, naps, diaper changes, and important milestones, all stored securely in the app. As we wrap up today, I just want to leave you with the key context for the resources that we discussed. We do have the City of Virginia Beach advocacy team. It's a dedicated team who is available to help with any of your health-related needs. Our team can be reached at 1-866-509-7567, Monday through Friday from 8 a.m. to 5 p.m., or by email at mylifemyplanrewards@sentara.com. Please feel free to reach out for case management support or any questions that you may have about your plan or your benefits. And we also have the Sentara Health Plans website, and you can find all of the resources that we discussed and additional wellness tools anytime on the Sentara Health Plans website. Thank you.
Good afternoon, everyone. My name is Christina Bray, and I'm a community health registered nurse for the Sentara Community Care Clinics in Hampton Roads. The Sentara Community Care Mobile RV is a primary care clinic on wheels. We offer a comprehensive range of health services and services related to the unique needs of women. All of our services are designed to promote overall well-being and early detection of health issues. We offer preventive care and screening such as routine pap smears, testing, breast exams, mammogram screening referrals, and HPV screenings. We also provide education on the recommended time frames for screenings and make sure you're up to date with those screenings. During the screenings, we can catch any concerning cervical or breast problems, and we also provide coordination of care to patients so they get the correct level of care for treatment and procedures. Our clinic also provides annual gynecological examinations, routine labs, testing for sexually transmitted infections, and referrals to specialists. We can provide education during problem visits concerning infection treatment, menstrual problems, birth control, consultations, anemia, and other chronic conditions. We will also refer and coordinate to specialists as needed. We also assess for any cardiovascular issues and provide that education. This includes checking blood pressures and BMI, screenings for high cholesterol, assessing personal and family history for any risk of cardiovascular problems, reviewing any medications, managing medication refills, and compliance with any cardiovascular management. Lifestyle changes are recommended with exercise, weight loss, nutrition counseling, one-on-one education with a health educator or case manager, and connecting. You can also connect with a community health worker for any social determinants of health needs or any social resources. And they can help connect with access to healthy food, gym memberships, and identifying community places that are safe to exercise. We also offer reproductive and hormonal health services and education that include menopause support, prescriptions for hormone replacement, and also alternatives to hormone replacement. We educate about any health risks related to menopause, bone health, urinary health, and maintaining sexual function. There are also ways to stabilize any hormone imbalances, especially related to PCOS or polycystic ovarian syndrome and endometriosis. We can also care coordinate patients to their OBGYN, any urogynecological or any hematology oncology doctors for any specialized treatments. So for all Virginia Beach employees, we have two sites that we go to. One is the school administration building, and the other is the Plaza Annex. And we're there every third Tuesday of the month, but the sites do alternate. So next month, we'll be at the school administration building from 11 to 3 p.m. And then in July, we will be at the Plaza Annex from 1 to 5. So you can give us a call at that 757-388-1830 number to get scheduled at one of those sites. Thank you so much.
Hi, everyone. The reason that I'm here is extremely personal for me. If you want to switch to the next slide, I'll show you a picture. This is my mom. My mom died from breast cancer at the age of 45. And losing her at such a young age forever changed my life. And because of that experience, I'm extremely passionate about making sure that women have both the knowledge and the access that they need to get mammograms. And I'm sharing and sharing this information encourages others to go and get screened earlier and save a life and potentially spare their family from a loss. I'm all for it. So here's your why. Early detection drastically improves survival. When breast cancer is found early, treatment options are often less aggressive, outcomes are better, and survival rates are they increase dramatically. Mammograms can detect cancer before symptoms even appear. Often people are extremely healthy and they feel nothing abnormal when they're first identified in a screening. Smaller tumors are typically easier to treat and may require less extensive surgery, chemo, or radiation. The earlier we can diagnose can make a huge difference, not only medically, but emotionally and financially for patients and their families. For 4 and 5, breast cancer is unfortunately very common, but the good news is that it's really treatable when caught early. So that's why routine screenings are so important, especially when cancers develop silently with no warning signs at all. We know that that dense breasts cause detection to be a little bit more challenging, but that doesn't mean that it's impossible. So quality imaging, experienced technologists, and consistent screenings, they really do matter. We recently had someone came in and say that their breasts were too large, they couldn't get screened, and we were able to show them that wasn't accurate, and that we have the skills to ensure that they are properly screened. For number 7, there's a huge healthcare impact. So early detection reduces your overall healthcare costs by avoiding advanced and very expensive treatment later on. And the last one is it's 15 minutes from the time you're walking in to the time that you're walking out, and that 15 minutes really could save your life. So here's a little bit about the purpose behind our mobile program. You may have seen our vans out in the community. We have 2 in Virginia Beach that travel around. I want to invite you that if you ever see them out at your school or a public location, please come on. We take walk-ins all the time. We know that breast cancer screenings save lives, but we also know that many women face barriers that prevent them from getting those routine mammograms. So our goal is bringing the screenings directly into the community so that some of those become a little bit smaller or even more manageable. So one of our biggest barriers is location. So not everyone lives close to an imaging center, especially in rural or underserved areas. We have transportation issues, long travel times, and we're doing everything to make it a little bit more accessible to you. Another barrier is cost. So some women delay their screening mammograms because of financial reasons. Every single person that comes onto our mammogram van is eligible for a mammogram. And if insurance is an issue, we have Komen funding, financial assistance available to cover. So I never want that to be the reason someone did not get a mammogram screening. And the last one is time. People are hesitant to get it because they think it's going to be long and lengthy, and it's actually a very quick process. So the time somebody walks onto the bus, registers, checks in, gets their screening, and they're back out in 15 minutes. So this visual really shows the power of early detection. When breast cancer is found through routine mammograms, it can often be detected when the tumor is as small as a seed. At that stage, treatment options are usually are usually less aggressive, and outcomes are much better. As the cancer grows from the size to a blueberry to grape or even a strawberry, they're more likely to be found during self-breast exams, and by then that cancer may be more advanced and harder to treat. So that's why regular mammograms are so important. I can't stress enough, early detection can truly save a life. So in order to be eligible for a mammogram, we want you to be 40 years of age. You can be 35 or years old if you have a strong family history and your insurance is willing to cover it. You want to come to us if you have no pain or concerns. If you're already experiencing something that's going on that's making it different, we're going to refer you into the clinic. We are performing only screening mammograms, not diagnostics. We need you to be able to ambulate up a few steps and be able to stand for your exam. The day of the event, if you come out to our van, make sure you bring your photo ID and insurance card if you have insurance. Again, I'm going to stress financial assistance is available to those who qualify. Anyone who does not have insurance would be covered. And then I put in there our website if you'd like to look for where our upcoming events are in Virginia Beach. And I just wanted to end by showing the inside of the van. So from the outside, there's no windows, and so it can be a little frightening to walk up to this van, but my team is extremely friendly and helpful and welcoming, and it is a clinic on wheels. It's absolutely gorgeous inside. We have 3D state-of-the-art technology, and we look forward to seeing you. Thank you.
Thanks, Jillian. What an incredibly informative session. I'd love to extend a sincere thank you to all of our presenters today. We truly appreciate the time and expertise you contributed to this webinar. We have some time for some question and answer, which is great. And we will try to get to as many questions as we can. And then, of course, if there are additional ones when it's time for us to log off, we'll make sure that we'll prompt you to email us those questions, or if you think of anything after the webinar, make sure you send those to us via email so we can make sure to answer your questions. On the next slide, I'll share our contact info before we wrap up, so that way you'll know how to reach out to us. We will be sharing the presentation slides with all those who attended, so you can receive those to review. And also during the question and answer portion, if you can just please remain on mute and then place your questions in the chat, this will allow us to address them a little bit easier as they come in through the chat. And then again, we'll just address them until we run out of time. So let's go ahead and take a look and see what we got. I know there was one question about the mammogram and the recommended age, but I believe you already covered that, Jillian. And then there was also another question asking if you can have your annual appointment done every year at the Glen Mitchell Drive location.
I don't know if that's a question for me.
Was that maybe annual physical? And that is more towards Sentara case management. Now, if that person wants to clarify in the chat, we'll make sure that we get that answered. Lots of thank yous in the chat. I do see where Tia posted the slides. So if you want to click on the link she posted, you can download the slides that way, and then I'll share them in the follow-up email as well, so you can have them to refer to later. And then the flyer that we shared this morning in the email distribution is linked there as well. And again, we'll share that in the follow-up email. Okay, that question was about getting her mammogram done at Glen Mitchell each year. So she's wanting to know if she can get that done at the mobile mammo van instead of that Glen Mitchell location each year.
Absolutely. Yes, you have the ability to get your mammogram done anywhere. And so the services that we provide on the mammogram van are as good of quality and read by the same radiologist as if you were to go to an on-site location. And I know I have a lot of teachers here, so I also do want to say that if you can't make it to a mobile event, we do have clinics open on Saturdays. So a lot of our clinics now offer Saturday appointments or even afternoon appointments up until 7 p.m. So don't let that be a reason why you don't get your annual mammogram.
Thanks, Jillian. Somebody else is asking, do you offer ultrasound screening versus the mammogram?
So if we have an individual at a clinic who does not want a mammogram for some reason, they would not be able to tolerate it, it is an option. It's just not preferred by our radiologist.
Right.
So I would definitely advise you to call the clinic and have that conversation.
And you may have touched on it earlier, but maybe this is a good time to mention it again. Would there be any reason that someone should not plan to get their annual mammogram on the mobile mammo van?
Yeah, if someone already has breast pain, redness, swelling, they feel a lump, those are all signs that you would need a diagnostic. And so that diagnostic imaging is different than a screening. A screening is going to identify if there's an issue, If we already know that there's an issue because you're experiencing one of those symptoms, we're not going to complete the screening. We're going to send you in for a diagnostic image at a clinic. And that's completed with a radiologist present, so you would get your results immediately.
Thank you. That's good information. And I guess since we're all here talking about the mobile mammo van, we do have a new visit that was just added to Thursday. So if you're due for your annual mammogram, there should still be some open slots at that mobile mammo visit that will be at Central Library from 9 a.m. to 12:30. So if you want to go back through the slides to get that contact information to reach out to schedule an appointment, here is your opportunity. Somebody else was asking in the chat if we'll send a link to view the whole course. Yes, we will be providing a link to the recording as well as a link to the slides that were shared. So you'll be able to receive those in the follow-up email that we'll send out. And I don't see any additional questions. So if you've got one, Brendan, on your minds, go ahead and put it in the chat. We'd love to be able to answer it live here for you right now. If I missed one, please put it in there again just to make sure we get your question answered. And we did just add a post-webinar survey to the chat, so we'd love to hear feedback from you on what your thoughts were about today's presentation and how we can continue to provide great webinar sessions for you. Give it a few more minutes in case anyone is typing a question. Yeah, I love Naya posted about just how many services are available for women. It was great to be able to hear from each resource and just hear about all the support that is there. Definitely encourage you to check out those resources and areas that apply to you. This seems like a question that perhaps case management can better direct. Someone is asking if they can get hormone therapy from their OBGYN if their primary care physician won't prescribe it.
For that question, I would definitely suggest that you speak to your OBGYN about that. They're going to know a lot about your health history, and they'll be able to guide you the best on that.
Okay. Thank you, Shelby. Somebody else who's joining our webinars for the first time today, we're glad you made it. We do have webinars each month, and those webinars are posted on our website, www.benefits@thebeach.com/s/BEWell-events, or you could click on the link that Tia put in the chat. Thank you. And you can view the events list of see what's coming up. We also have them posted in our Personify Health calendar. So if you want to stay up to date on all our upcoming webinars, you can be sure to check in there regularly. Somebody was asking an eligibility question in the chat. They are planning to retire. Congrats, that's exciting. And they're wondering if BEWell services are terminated at retirement. Tia posted a really helpful link on our website that explains just what happens when you terminate and when those BEWell benefits terminate as well. If you retire and you remain on our health plan through through the City of Virginia Beach or Virginia Beach City Public Schools, then you are eligible as a retiree to participate in our programs. All that information is on the website as well. So be sure to save and check out that link. Lots of thank yous coming in. Again, I'll move to the next slide. If you think of anything after our webinar, please be sure to email us so we can help answer any of those questions that you may have had. You can reach us by emailing us at bewell@vbschools.com or by calling 757-263-1060 and selecting option 2. Let's go ahead and see if anything else popped in. I think Bill Sloan he's also one of our points of contact with Sentara Health Plans Case Management, and he suggested that you can also reach out to case management for assistance with finding another provider if you'd like to have a second opinion. I think that is in reference to the hormone therapy question as well. So if your primary care physician is not moving forward with your not addressing your question, or you want to get a second opinion, you can reach out to case management for that assistance. I don't see any other questions coming into the chat, so we'll hang on here for a couple more minutes, but thank you all again for taking the time to be here, and I hope you have a great evening. You can feel free to have a few extra minutes back to your afternoon, and I hope you have a great night. Thank you, everyone.